Hello, my name is James and I have sleep apnea. That means when I'm sleeping, I stop breathing. Now, my type of sleep apnea is obstructive sleep apnea. That's when the air passage in my throat and in the back of my nasal passages closes off. It could be due to being slightly obese. It could be due to just having too much flesh. Now, when I was diagnosed with this, I was given a CPAP machine. That's a continuous air pressure machine. And it actually did help quite a bit. I felt better immediately, basically the next morning. And it's taken it's been almost 5 months now, and I feel a heck of a lot better. But the problem with this machine is it's big and uncomfortable. Let's take a look. This is the CPAP machine. The machine itself is very simple to operate. Push a button, you turn it on. That's it. This hose, which looks a lot like a vacuum cleaner, or like one of those hair dryers you'd see at a stylist, fits onto a mask that I wear over my nose. Let's see how that works. The CPAP mask that I wear fits over my head like so, adjusting the straps to make sure they're not too tight, and clipping them together. I basically have this big elephant nose sticking out of my face when I'm sleeping. And when I say elephant nose, I mean elephant nose. Now, don't get me wrong, I appreciate having this CPAP device, but it's not always convenient, and sometimes it's a bit noisy. It sounds like an air pump pumping every night. It's also not very convenient when traveling. So I decided to research online, and I actually found something. The aveoTSD device. This is just the carrying case. This is the device itself. Look how small that is. It fits in the palm of my hand. Now, what this does is it actually sucks onto your tongue and keeps your tongue from falling back, and thereby leaving the passageways in the back of your throat open, and in most cases for obstructive sleep apnea, preventing snoring and preventing the apnea itself. Let's see how this works. Now, I'm going to do this in the mirror so that I can see what I'm doing, and so can you. Now, this may not look pretty, but this actually works. It's a suction bulb, and it goes on your tongue. I won't be able to speak when I put this on, so just watch. It was stuck on my tongue, and that actually does stick on there pretty good, and it does prevent my tongue from falling to the back of my mouth. But does it work? Well, I did a test. So I've set up this wireless infrared camera right over my bed, where my head will be, to record on a VCR. Picture's not the greatest, but it's going to be good enough. Anyway, I need to use a VCR to get long play tape. So I'll be laying here like that with the camera recording me, and it should even see me when I'm in the dark, so I can check to see if I snore when I'm sleeping. And I'm going to be trying different devices: my CPAP machine, my anti-snoring little rubber dealy thing that I talked about earlier, and also just breathing normally. And we'll see what happens. And here's me without any device, snoring. You can see that as I'm struggling to get air through my closed off air passages, my neck is constricting. It's a lot of work I'm doing right there, and that's probably actually taking more oxygen to struggle that hard. Here I am with the device in my mouth. One thing I noticed in this picture is that I don't know if you can see in the video, but as I'm breathing, my chest is doing slow, even up and down movements, not like before where it looked like I was forcing it, or where I had to force air through a small space. So my neck is not constricting as I would inhale. Here's a quick comparison. There's my neck, my chest. I'm breathing with the CPAP mask on. no strain in my neck, my chest is moving up and down evenly. Perfect. So in conclusion, it appears that the aveoTSD device that keeps your tongue from falling back into your throat did help me quite a bit. It didn't seem to help quite as much as this mask, but you know, traveling or sleeping on a plane or at home, if I don't want to make noise to disturb other people, I think I would choose this over wearing this every night. And that's my report. Thanks.